Hey guys, it's your girl Nikki Proverbs 31, and I'm coming on today to kick off my official pregnancy vlog. So this will be a review for my week 4 of pregnancy via IVF. I am, just a little backstory for those who may not have watched any of my videos before. I am currently 37 years old with my second pregnancy. My first pregnancy was via IVF, and we have a beautiful baby girl named Nia who is 3. And we just went through IVF again and got our big fat positive last week. Our official one was April the 1st for our beta. And I am so I'm 37 years old. I was diagnosed with hypothyroidism about a couple of years ago, and I have been diagnosed with fibroids. So this pregnancy is not just an IVF pregnancy, where you can follow me through an IVF pregnancy, but if those of you who are currently pregnant or will be pregnant and have fibroids, or who have been diagnosed with hypothyroidism, you can follow me on my journey to have my daughter some siblings. So last week, April 1st, I got my beta. It was 25.3. My second beta, well, that Monday, which was the 30th, Monday the 30th, I started having the brown spotting implantation bleed, I believe, just like I did with Nia. So I knew then and there, and then because my home pregnancy tests weren't as dark as others, and being that I know in my previous pregnancy my beta levels were not the highest, and I honestly have not proven this yet, but I do think the hypothyroidism may have effect, because there are just some women who have starting off low HCG levels, and then there are people who have high HCG levels and they think they're pregnant with multiples and they're just pregnant with singletons. So it just varies, and I've learned that HCG levels is not the first number that's important, is that it doubles in a matter of time, which is 48 to 72 hours they would like to do within the first, I think, 5 weeks or so. So anyway, if you get over, I think, 2,000. So I got my, again, just to recap, week 4. So that Thursday I went and I had my second beta, and it came back 52. Okay, first beta was 25.3. Second beta was 52.9. That was that Thursday. So they doubled 1.8 days in between the first and the first beta and the second beta. So Thursday was all good. Friday, I started feeling a little crampy, and then I started spotting. It was more brown spotting, and similar to what I had experienced that Monday. Kind of TMI discharge, dark brown, burgundy-ish discharge. So I called my RE's office that Friday. I called the location in Grand Rapids, and the lady that I talked to said, put me on hold. She didn't take my information or anything, and she just said, well, brown spotting is common in it, so don't worry about it. I'm like, okay. So I just told my husband I'll just wait till Monday and talk to my local one that knows my situation. It has my chart, actually, that can see, that I've experienced bleeding and subchorionic hemorrhage as well with Nia, which I am not receiving for this pregnancy. So I believe that Sunday night, because I have been having little cramps with that Sunday night. Oh, Saturday was our 6th anniversary. 6 years of being married. And it was actually a Saturday. We got married 6 years ago on a Saturday. So it was a perfect, situation. Like, oh, we're going to go out. We're going to have such a romantic time. And I was still spotting, and my husband and I just didn't feel comfortable with just going out and doing stuff. So we stayed home and just relaxed and watched 12 Years a Slave. So Sunday evening, I was like cramping a little bit, but then when I just, for the most part, stayed in the bed. We didn't go to church or anything. And then all of a sudden, and I was still spotting, I just felt these stabs, like somebody was literally in my uterus stabbing me with a knife. And it went on for about an hour or so. And I was just thinking, oh Lord, what's going on? And on my Facebook page, I even said, was trying to combat my thoughts or fears with the Word of God and speaking the exact opposite of what my fear was trying to speak to me. And I had to watch going on Google, Dr. Google, who tried to tell you you're miscarrying and blah, 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 blah. I had to rebuke that. And if those of you don't know what rebuke is, that means like, I stop you. Nope, not receiving it. Bye. So, so that Monday morning, I called my RE, and I told her about my RE's IVF coordinator, nurse. And she just said, okay, well, let's, for right now, you move up your progesterone and oil to 1.5, and we'll do another beta test. And also, I had mentioned, I was like, wait a minute, I do have hypothyroidism, and I know that I'm supposed to have my thyroid checked. Should I have my regular doctor do it, or do you all do it? And so they wanted me to do that. So if you have been diagnosed with hypothyroidism, I would suggest as soon as you get pregnant, get your levels checked. And they probably have to check it every 2 weeks or so. Because especially if you're on, I'm on Synthroid, the baby or babies that are growing inside of you totally depend on your thyroid for everything. They're I think up to 12 weeks. So it can totally deplete your thyroid, and also it could cause miscarriage if you don't have your levels checked and they're not at a good level. So that's a little nugget that I found out. So I actually haven't got my results back from that. Anyway, so she told me to go in and have my blood work done for both another beta and and for my TSH, which is for thyroid. So I called my location here that I was doing the local monitoring, and they got me in for yesterday morning. So here's Mia. She's coming. Let me hurry up because her hair isn't right yet. Oh dear, she's coming. Okay, so let me try to hurry up and do this. I'll be back. Hold on. Sorry, I had to get into mommy mode real quick. So I went yesterday to do my beta first thing in the morning and my blood work at the Michigan Center for Fertility and Women's Health, which is located in Warren, Michigan. So I walk in and they know us by now. And remember, I don't know if you guys remember, but I was saying that it was a very seasoned lady that was there who was doing my last, one of my last ultrasound, and went thoroughly with me over every last follicle, how big they were, and just gave me so much peace. Well, she was standing there and she mouthed to me, congratulations. And I just said thank you, and I gave her the biggest hug. And I told her, I said, I want to personally thank you for what you did. You don't know what you did, but what you did blessed me. And so that's just a side nugget. You never know, just a small little thing you do for someone, to go out a little bit out your way to help a person, how much an impact it can make on that person's life. So, sometimes we can get so focused on our life and the rules and regulations of things that we lose the human touch or the humanity part of it, and compassion. And if you just show a little compassion, you have no idea how much you'll bless that person. And then you will need that compassion and humanity, to be shed upon you. What the Bible says, you reap what you sow. So I just was so appreciative, and we went in the back and did the blood work, and you know, by that time, everybody knows Nia and gives Nia candies and stuff, and so it was cool. So I waited all day to get my results, and wash your hands, Nia. Sorry, I can't edit this out because I'm doing the YouTube capture. So anyway, I went over to my grandmother's, waiting and whatever. I had to call back because they were saying that because I'm doing progesterone and oil. By the way, TMI, I am so sore and I'm lumpy. I got a lumpy butt. A lump bump. A lump butt. So I had to, sorry, I had to go into mommy mode. And again, I apologize. This video is going to be very choppy because I'm using YouTube capture and I'm unable to edit that, you know, a good flow. And when you have a child, you have to stop, and they come first, and they will let you know that they come first. And hopefully these videos won't be as long, nor will it be as choppy. But if it doesn't and you don't like it, don't watch my videos. I'm sorry. That's what happens when you have a toddler. But, so, anyway. So I finally was able to get in contact with my RE nurse because I wasn't hearing back from them. So I called and stayed on hold. And she told me, she said, your numbers look good. I was expecting it to be about 350 since I was doing the doubling every 48 hours. Since last Thursday was 52.9. And she said, your numbers look good. They were 491. And she hadn't got my thyroid back yet. So I'm still waiting on that. So my symptoms: cramping, the brown spotting, hungry a lot, bloated. I feel like, okay, because I have fibroids, my uterus was already measuring as if I was like 3 months pregnant, 3 or 4 months pregnant. So add on the pregnancy and the IVF medication and stuff, I look like I'm a good 6 months pregnant. Matter of fact, I'll show you real quick. See? You would think I'm about six months pregnant. I'm not. I'm 5 weeks. So, bloating, you know, big belly. And I had to start wearing some of my maternity clothes because there's nothing working right now with this belly of mine. And the thing of it is, if somebody asks you, oh, how far along are you? You just say, about 5 weeks. They're looking at you like, with what? Quadruplets? Anyway, so my other symptoms was hunger, sleepy, of course. I don't really have any like sore, you know what's, or the nausea or anything like that, which is good. And that's about it. So I know from my previous pregnancy with Nia, because of fibroids, so if you are a woman who has fibroids and you are expecting, you have to take it more easier than someone who doesn't, because your uterus is already under some kind of pressure and irritation because of your fibroids. And you may, and this, I'm not speaking this, but for me, I've had the cramping more so is from the fibroids than anything else, because I was having problems with cramps when I wasn't pregnant. So my ultrasound is next Tuesday, and we're pretty excited about that to see who's all in there and what's really going on. That's about it for now. So today is Wednesday, the whatever day it is, the 9th, April 9th, and I'm currently 5 weeks pregnant today. So how do I feel overall? I am so blessed, so grateful, so thankful, mainly, you know, for life and for God and His Son and my family and friends, and for you all. I really appreciate you all. And there have been a few ladies that have even inboxed me and said that they're doing IVF and just got their big fat positives or about to go through IVF, I read your messages in your inbox. I am going to respond to you all. Just please just give me a little grace, because I do get a lot of people just inbox me, and I want you all to inbox me or send me a private message on Facebook. That's what I'm here for, is to help you guys. It's not just about me. It's not about me, actually, because I could do this and not post it, but it's for you all as well. And I want to rejoice with you all when you have those great results, or even try to encourage you when you're not having the best results. So keep those questions and comments coming. I appreciate them, and I look forward to next week. I will actually do my review for my 5-week pregnancy and include the results for my ultrasound, which will be that Wednesday. My ultrasound is Tuesday, but my review will be on that Wednesday. So again, thank you all for your prayers, and I'm just so grateful to God for you all, and I appreciate you following me on this journey. And I know it's going to be a long journey, but it's going to be a great one. I just believe that. So, all right, I've talked way too much. Sorry about that, you guys. Smooches.